Welcome to the LA Story Podcast with Stevie Wilson.
Hey people, this is Stevie for the LA Story, and we're back with Dr. Marc Mani, and we're going to talk to him about a new kind of facelift. This is cutting edge in a pun sort of way, but it's really so innovative and so advanced and so new that when I had talked to Dr. Mani about 3 years ago, we were talking sort of about this, but not. He was telling me about this procedure, but not telling me anything about it. So I was always kind of trying to get the information.
That's right. It was a little more of a state secret at that point. It was in the early stages, and it was before the company, which is Johnson & Johnson, had sort of authorized me to do a little bit more talking about it in the media. But the procedure is basically a harmonic facelift. So in doing the facelift, I'm using an ultrasonic instrument which vibrates at 50,000 times a second and stops bleeding and seals blood vessels as I'm cutting. So the end result for patients is that they get the same result that they would with a normally sort of more invasive facelift because the surgery is otherwise done in the same way, but they have a much quicker recovery. And they're back to work or back to dinner sometimes in a couple days, and sometimes a few more days than that, but in general dramatically less time is spent recovering from the procedure than they used to have to spend, which is really important for patients that are on camera a lot. They want to get back to work, they're booking movies or whatever they're doing, and they need to be out in the public eye, or even just for busy professionals, they want to get back to work and back to looking normal. They can get back within about 7 days or less, as opposed to 2 to 3 weeks, which is the norm in the past for this type of procedure.
Wow, that's impressive. Now, does this decrease the risk because it's sealing off the blood vessels?
I wouldn't say what it decreases the risk of is pain. There's less pain.
Okay.
It is less traumatic to tissues than the previous types of technology were, because there's a much diminished spread of energy, of harmful energy through the tissues. So it's a much more precise way to do the surgery for me. That's why I enjoy it as a surgeon, and I personally think it's safer for my patients, because I do think in the same way that it reduces bleeding and bruising after surgery, it also can decrease the risk of having blood collections develop underneath the skin, which is one of the risks of facelift. So for me, in my hands, it has cut down those risks, but most importantly, as a practical matter, it makes it a much quicker recovery procedure.
That's nice. And then the results are pretty much, would you say they're pretty, well, you're always doing the surgery, so the results are always great.
Exactly.
So the point being is that, does this help in terms of improving the results, making it easier for you?
It's a good question. I do think it improves my results. I think anything that you can do that reduces swelling will improve the long-term result from a facelift, because when the face starts to swell after a facelift, the swelling will stretch the skin out, and I think that can sometimes compromise your result. You can stretch the incisions, can make the scars a little wider. So I think that the scars are healing better with harmonic, just because there's less tension on the flaps, and also the skin doesn't stretch as much. So I think you get a more, a more secure and durable long-term result as well with this technology.
Okay, and this is done obviously under general anesthesia.
Actually, not necessarily.
Really?
This is one advent that has let me do facelifts under local anesthesia. So there are certainly certain patients that are afraid of anesthesia. I don't think that's really a rational fear, because going under anesthesia in an elective situation is really as safe as crossing the street, crossing Sunset Boulevard right in front of us, even with the light. I think you're safer. It's like being afraid to fly, which some people are.
Yes.
But the nice thing is now we can accommodate that fear and just do the procedure under local anesthesia. I'm sitting there talking to the patient the whole time, very calm and reassuring them, and basically have had very good experiences with that, where the patients not only save the theoretical risk of going under anesthesia, but also they save the money, so they don't have to pay an anesthesia and operating room bill, which can amount to thousands of dollars for this type of procedure.
Yeah, it does, usually. That's my, having had a couple of surgeries, yeah.
You know how, everything you can save can, and then also the recovery ends up being a little bit quicker, just because you don't have to wake up from anesthesia, so you don't have the, occasionally there's nausea, there's other problems like that, and
yes,
sometimes you're just a little slow to wake up, so this is something that allows you to avoid that as well.
That's very cool. And how long does it take to do one of these surgeries then?
Well, I'm an artist. I've been drawing and painting since I was a little kid, and so I take my time. Art, good things and perfection usually takes time. So I'm not rushing it. I'm not billing this as a lunchtime procedure, because if you really want a more natural aesthetic result that's very precise and finessed, it takes time to do it right. So to really reverse the changes of aging in the way that they occurred means getting into the certain anatomic spaces in the face where the aging happened. And it just happens that those spaces are actually more easily accessible for me with the aid of Harmonic, because it separates tissues very easily and delicately. So I love it for that, and I think that's allowing me to get more natural results with it. But going back to the point of how long it takes, that's a long way to give you the short answer, which is that a facelift takes me anywhere from 4 hours to 6-7 hours, depending on whether I'm doing the brows and other things like that. So patients have to be prepared to be still under local anesthesia for that period of time, which is a long time. But we make them comfortable, massage their feet, have special things there to make the whole procedure easier and more pleasant for them. Cool.
People, we will have before and afters of the Harmonics facelift too, and this is really something so different, such an advance in the treatment for this particular procedure that it's unbelievable when you see this. So if you're actually contemplating this, you might want to really seriously contemplate finding a doctor that does this and is extremely experienced, like Dr. Mani. He's been doing it for quite a while. I mean, going out and teaching other people too.
Yes, I've been lecturing lectured in Brazil. I'm going to Russia in a couple weeks to talk about this and some other concepts in facial anatomy. So that's been an exciting process of educating other plastic surgeons how to use it. But it's exciting to be among the first people that's using it, because the patients have really benefited from it, and that's the great thing about it.
Yep. So people, you'll find all the information on the website. The website will be on the blog, and all the links you need. Also, don't forget his Facebook. I don't think you have Twitter yet, do you?
Not yet. I'm working on that.
Okay. It's a little time consuming, I know.
I know you've been doing it for a long time.
A very long time.
You were one of the first people I saw talking about Twitter, I think, on Facebook. I think you were.
Oh, really? Okay, that's a good, well, that's a good
thing. I didn't
thing.
even know what it was at that point, so.
I'm always pushing Twitter too.
Good.
Okay, people, we'd like to thank Dr. Mani for his time. This is really, really long overdue on this particular topic. And this is really something new and different, and I've been waiting to actually, because I was actually haunting his YouTube channel looking at all the videos, because I saw the device itself, the knife, the surgical knife. That was really cool. So we'll put that video up too, so you can see that. And this is really such an improvement. So this is Stevie thanking Dr. Mani for his time, and we will see you soon, people.
Thanks for joining Stevie Wilson on LA Story. Feel free to check out other podcasts and videos. Bookmark it now. www.la-story.com.